comments from the group?
Barry, this is Mike. Can you hear me?
Yep, gotcha.
Yeah, Emily, thank you for that really excellent summary. And I don't know if Joel is with us, but if he is, he can take over this line. But as this group may remember, Joel did some modeling about some potential issues, and I think Emily has really underscored kind of what we're seeing in the present. But as you all are aware, the governor did extend, right, the eviction moratorium. That also means that that tsunami that we were worried was going to happen now didn't. We have reprieve. That also means that we have some time to do some planning. And so there's a possibility, and our group discussed immediate term, and you heard from Emily what we're needing right now. But, ending in March, if any of Joel's predictions come even close to correct, we're going to have a real big issue on our hands with families with children. So whatever this group can do and the folks in decision-making roles can do to have us be in a more prepared state. I think Joel was trying to draw our attention to that a while ago. I don't know that we made great progress. I think we can make better progress in being more ready should we have an eviction tsunami. We'll have to be very responsive, very quick, and there'll be a lot of people to place if we can't stave that off as a community. So Joel, just hats off to you for bringing that to our attention. I just want to bring that back up. And Emily, thank you so much for really outlining how children, they really don't have that capability to protest or to be loud or to show up at our Zoom meetings or to send any comments. But they're some of the most vulnerable individuals in our community. And those numbers just continue to increase. And I'm sure we all knew this, and we do not want to beat a dead horse. This is not a dead horse. This is an ongoing and very serious issue. I'm proud to be working on this subgroup and the subcommittee. I think we'll come up with at least some recommendations. We don't have money, but I think we've got some really good hearts and minds in there, and we'll hope to bring something to you in the next couple of weeks.
Thanks, Mike. Before I call on Tara, Joel, did you have anything to add?
No, thank you, Mike. I think he summed that up pretty nicely.
Okay, go ahead, Tara.
Thank you. Good afternoon. A comment to Mike Parker. Tyler's not on the phone today, but we've been watching the federal stimulus dollars and paying close attention to where those are coming. And the county is going to be receiving almost $7 million for rental assistance. So our hope, and that's for 80% of AMI and below. So our hope is to stave off some of what Mike's concern is with eviction moratorium ending. Now that's new information, so we have to give the county staff a little time to put things together. I also wanted to say what Emily was talking about. Since your last meeting, the city has added another $50,000 to motel stays. And before winter came, as we were planning, looking at base camp and overflow, we did want to get a handle on motel stays and where the dollar amounts were. Because this last year has been so crazy and the OC and Lydia Place have been working so hard and frantically and getting dollars out, we just didn't get quite the feedback we needed just due to volume. So we're trying to deal with that. What I've asked Samuel Letts, and Tyler and I have talked about this, is to, in speaking to what Emily's talking about, is we as a community need to, we know where we're at right now with motel stays. Emily's told me that there's plenty of rentals available. So we need to figure out.
Plenty might be generous.
Okay, maybe that's changed since a couple weeks ago. We need to figure out by next winter, how do we transition from all these motel stays into a more permanent situation? So that is something that I've asked Samia, who oversees our funding, is when we bring our city council, our recommendations for this coming year, which is going to be in May, we want to develop a strategy so we can start to shift those dollars as a community, if we can, away from motel stays and into permanent housing. So it is something I just wanted to make are involved in and working with the Opportunity Council and Lydia Place on. Thank you, Barry.
Yep. Anything else for families with children? Marcus.
Hi guys. I missed out on an awful lot recently. We were starting committees and I lost power out in Sudden Valley, so I'm just fresh back. So if there's anything that y'all think that I should be brought up to speed on, I'd love to be. But I'm not done talking about Camp 210 when we get to that. If you haven't gotten all the way to that, so thanks.
We haven't got there yet.
Great, thanks.
Anything else on children and families with children subcommittee? Okay, we'll move to Mr. Lillquist and the Funding Subcommittee. And I apologize, I couldn't make that meeting on Wednesday. Wednesday was just a pretty bizarre day all around, so.
Understand. By the way, Councilmember Knutson fell off this Zoom call. He just texted me. He's trying to get back on again. So let me try to describe where I believe the Funding Committee fits into this, where it fits into the picture. As Mike Parker said, they hope to come up with recommendations, but no money. We're the opposite. I think we're all hoping that there are concrete recommendations for action out of this committee to address populations of people who are experiencing homelessness or new efforts or new approaches. And the usual question will be, how do we pay for that? And so the Funding Committee didn't really make any progress at a meeting this week. We had a lot of good discussion. One thing that was pointed out is that Emily is involved in a number of groups and efforts in the county that are addressed at kind of community welfare issues, child welfare or health issues, and many of those include a housing component. And so it would be useful if our funding solutions for kind of homelessness were sort of coordinated and embraced other efforts that have to do with housing concerns that are aimed not at homelessness per se, but at community health, generally speaking. I don't think there's much more to report from that. We hope to meet again in 2 weeks and eventually flesh out funding mechanisms and the general scale of the dollars that might be available to fund any recommendations. So I'm hoping the other committees come up with recommendations and we can offer some funding mechanisms.
Thanks, Michael. Questions for Michael? Okay, communications.
I guess that's me. Okay, so we have tried to meet underscoring as often as possible, with the holidays and everything going on, underscoring the urgency to, the priority of communications and how the role that plays in all of the aspects to this. It really is a big topic that we're trying to get our collective heads around here. And so right now we're in the process of defining our role as a subcommittee in particular, and sort of chopping that down into bite-sized pieces, I guess, and things that we can actually address. One of the biggest things being that we need to define what we are not and the role, and there may be some misunderstanding both in this group as well as in the public as far as our role as a subcommittee. So I just wanted to clarify some of that. For one thing, we're not, well, I think as Emily mentioned, also for the Child and Family Subcommittee, we're not a funded committee or entity. And so all we can do really is provide recommendations to the county and possibly the city. And to that end, we felt that it was important that we get representation from the city and the county on this board. We already have Riley Sweeney with us. Thank you, Riley. And for the city of Ferndale, and we are adding Jed Holmes and Janice Keeley from the county and the city communications. They've agreed to join us as well. So we're moving forward with that. We have had requests from members of the community to join us in that committee, but we're going to hold off on that for just a little bit so that we can really define our role at this point and not get too sidetracked. we will be in touch with those who have reached out to us. Let's see. So a couple things that we want to be clear on is that we as a committee are not a messenger or a mediator to, or between members of the public or our unhoused neighbors or the county. We're just here to provide, again, recommendations to, strategies, communication strategies that we think will be effective, most effective, hopefully, for moving forward with, especially with regard to these subcommittees. And, like Councilmember Lillquist said, just looking for, places to aim and move forward. And soon as we get get a direction to aim in, then we'll be probably talking with you, Michael, and that group to try to figure out how to fund those and how that channel opens up. And so it's a lot of piecing things together as we go. So our current discussions in our meetings thus far have centered around really the need, excuse me, to develop those lines of communication between the current organizations, municipalities, and the public and community with regard to, really four main things: the issues surrounding homelessness in Whatcom County, the efforts that are currently being made, the impact and effectiveness these are having, and then especially what's needed to fill those gaps and shore up those efforts. I know in reading some of the comments, J.C. Mansfield and Dina Jensen, I do read those and I do appreciate all of your input, and both publicly in speaking, but particularly in those letters, they are very helpful, and I just wanted to say that we do listen to your ideas, and we're going to present those in those committees and subcommittees, and those are the best ways to do that. So you may not see that necessarily here talked about, but those subcommittees are, that's the tool that we're using to be able to really dig deep and jump into those strategies and come up with something that's really workable. And I hear the plea to really communicate with the people on the ground, and especially those in Camp 210 who are at the moment the most visible, but also for those who are not visible, who are not participating in that, and prefer to be in the shadows. It's a difficult thing. It's communication is key. I think we all agree. But I also believe that the most effective way to address and to communicate is as a community. And for that reason, we've chosen at this point as a committee to focus on that aspect of it, and in the communication with the public and the community, and trying to help create those channels of communication. Again, we're not the messenger. All we can do is recommend what needs to be done to help this entity communicate with this entity and put those messages out there. So that's really where we're at. We're going to try to meet every week as much as we can, and get participation. We'll bring on participation from other members who are involved as soon as we can.
Okay, questions, Marcus?
Yeah, kind of a question and more of a comment. But I really appreciate that good work and that great description as well, Joel. Appreciate you coming by to have a look at 210 early on, to have see what you could perceive the needs might be, etc. I also want to acknowledge today that, and this really does fall into this place, is that KZAX, a local radio station, is broadcasting right now. this meeting. This gives unprecedented access to a lot of folks who don't Wi-Fi signal or phones or any of that. And so I'm glad that is out there. I tried to widely publicize it to the best of my abilities. I hope that maybe we can embrace other radio simulcasts, and I don't know if it's even possible to do call-ins or anything like that, but it might be neat to be able to have that kind of public access, better public access for folks. But I'm really glad to have
Oh, we lost you.
Unmute yourself, Marcus. You're back. You froze for a second.
Yep, I'm sorry. I just lost my signal and now I'm back. But yeah, I just want to embrace that, and I want to ask us all to take a good look at the possibility of getting this meeting better out there on whatever channels that we can as far as communication is concerned. And while we're talking about the committees, I am terribly sorry. Emily did reach out to me after my last expression at the last meeting that I didn't seem to get my my wants noted there, and I have been at a dead run since the last time we all talked. And so I'm sorry, Emily, I didn't get back to you. I'm interested in basically all of these committees except the one where you all worry about the funding, because then I figure I can talk to you about what I need and you guys can worry about the funding. But I just want to express my interest in that right now. If I can get thrown into those committees, I'd really appreciate it. Thanks.
Any other?
Thanks, Marcus. That's a good suggestion. I appreciate that.
Any other questions or comments about the communications subcommittee?
Yeah, Barry, this is Mike. I had something real quick.
Go ahead.
Great. Joel, thank you so much. And Riley, thanks again. I was joined Riley and some others in the first iteration of a communication committee. So thank you guys for taking that standard. One of the things, Joel, is I was listening to you, and I'm sure the last thing you need is unsolicited advice when I'm not on your committee. But it's the word that came to mind was gap analysis and figuring out the role. I think you've got folks on there and could tap into others who could really at least call out where are the gaps, and maybe even make the first round of some suggestions or some needs to address them. So just to put that in your committee's thought box, that could be a product that you all might create, and then make that recommendation that, hey, we've looked at this, we've analyzed this, here's where we think some of the gaps are, here are some possible first steps to address it. So that's just a thought, and a thank you for that work that you all are doing.
Yeah, I just want to respond to that real quick, Mike. Thank you. That is not unsolicited at all. And that's along the lines both for communications as well as child and family committees that I've been thinking about and sort of mentally visualizing, and I'll send out something hopefully in the next week.
Riley Sweeney.
Okay, so just wanted to we had some discussion about where the biggest gap was in our last committee meeting, and it really centered around this disconnect between public perception of our efforts to tackle these issues with the unhoused. That seemed to be the biggest disconnect. That people see that there isn't any effort being put in, or that the effort that's being made isn't making an impact, right? We talked pretty extensively about that. And so I suspect that our efforts moving forward will center around how to raise the general information of all the different organizations that we are connected with and the general public, so we're all on the same page, using the same language, and communicating the work we're doing and the impact we're having in a strong and effective way to the public, because that builds support for future efforts.
Anything else for communications? Emily.
Yeah, I think, this is something that the funding committee is also talking about, is like, what are those gaps and how do we communicate about what the needs are? And I have, seen some comments recently that sort of illustrate what Riley was talking about, which is that we aren't communicating about what our system response capacity is and the effectiveness of those interventions. The challenge is we don't have enough, right? So I was doing some number crunching this week. I think the last housing pool report was from October, and that's the tip of the iceberg. It's one representation around unsheltered homelessness, but it's not the whole issue of housing, right? So sort of separating those things out when we're talking about them. But our our coordinated entry system serves, and Mike Parker, you probably could correct me, but something like, I don't know, 2,200 households every year. I think it was one of the last numbers I was aware of.
That's correct.
And great. So 2,200 households a year get served through our system. And that is money really well spent. The reason we don't hear a ton about some of that is because that's success moving through the system. Not everybody is able to be successful. We can't meet everybody's needs, but it's really important that we talk about the interventions that do work. We talk about permanent supportive housing and rapid rehousing and programs like, you know, deposit assistance and diverting people out of the system. The challenge is we don't have enough resources to meet the need. And so sometimes when we don't communicate about what we are doing and what does work, what we're left with is what we see. And what we see is a crisis around homelessness. And I get that. I was crunching some numbers this week. I think we have like 470 something people on the waiting list, which is, you know, we would need a little army of case managers, like 23 case managers. If that's what we would need to fund, is 23 case managers, and then something like, and don't quote me on these numbers because this was just me messing around, but like $6 million a year to do all of the rental subsidy that would be needed for permanent supportive housing and rapid rehousing just for that 470 people, right? Which is not the extent of the community problem. It's just the extent of the people who are on that waiting list. So, and when we don't continue to invest, we continue to see that number grow. So it's so important for us to have honest conversations, and I don't want to see us tearing down good efforts and not like collaborating and recognizing that when we make investments in meeting people's needs, we see good outcomes. So that's, you know, coming back around to both communications and funding, and the things have to go together. We need more resources to be able to scale up interventions that work, so that we need less crisis response in the long term. But I just wanted to, you know, in the chance that there's a lot of people listening today, I want folks to hear sort of what it is that's happening and what we're trying really hard to do. We just don't have enough capacity to serve everyone we need. And if we did get those 23 case managers and $6 million in rental subsidy, you know what else we would need? We'd need a lot of housing units available to be able to put people in units, right? So this is a community problem. We've all got to come together in a really creative way to address the housing shortage and then the supportive services that are needed. And so anyway, just throwing some not perfect by any means numbers into the mix.
Emily, thank you so much for sharing those numbers. And I just wanted to clarify that the number that Emily gave, that 2,200, is actually individuals. Households is more like in the 1,300s. And those numbers were from 2019. We would expect, based on the numbers of eviction prevention households served in 2020, that number probably grew. But just for the folks at home, that those were 2019 numbers, and it was over 2,200 individuals were assisted with the housing system. Thanks, Emily.
Anything else on communications? Okay, thanks, Joel. Well, I think we should dive into the issue at hand, that's just Camp 210 and what we're doing around that. So I don't know how we want to kick this discussion off. I guess since this, you know, the occupation is over at the city hall, Mayor Fleetwood or Tara, do you guys want to at least start the conversation, and maybe we can? Yeah, would you?
Sure. Where to start? Monday is 2 months. The encampment at City Hall began, as people recall, on the afternoon of Veterans Day, November 11th, when 5 tents were put up, 4 of which were occupied, 1 of which wasn't, 4 of which were not occupied by people, 1 of which was. I was notified by our police chief when it happened, who had consulted with legal and looking at the codes and the requirements on notification, it was decided that that should be tagged and give them notice. And of course, the next day, a protest had shown up and guarded the tents. It was the sort of official awareness of the beginning of what has been characterized as a protest, and is now a full encampment on the lawn of City Hall. I heard many calls early on from different sectors urging me to authorize a physical dispersal. And as people know, I had a range of choices available, from doing nothing to a formal physical dispersal to working on the issue. We've acknowledged a need for increased capacity. We've stated our intention to create conditions to justify ending the encampment. And that's what we've been working on. As the days turned into weeks and now quickly moving towards months, the pressure to resolve this and end the encampment has only increased. And as some of you may know, I'd indicated that this is going to be coming to an end in the month of January. We continue to do the harder work of getting tiny homes and finding operators and sites and putting them up. Our thinking has been that between base camp, which has been at about, and I let Hans offer particulars, but just as I follow and get updates, has had availability of close to 80, 90, 100 available spots. That was quite the effort creating base camp this year. A lot of effort from staff and community members went into that effort, and it's available. So we know there's a site available at the drop-in center. We've put up the Swift Haven site at Civic Field. We've created a 57-bed isolation quarantine facility through the joint effort at the Whatcom Unified Command to be prepared for the COVID emergency. Actively working on trying to cite an additional site, indicated our willingness to purchase tiny homes. We are committed to continuing conversations about the longer term, the need to consider, and in some cases reconsider, how we go about providing response in a more permanent nature. I look forward to those conversations. Again, we remain committed to it, but it is our position that the condition and availability permits the ending of this encampment. There's a lot of compelling reasons. I haven't even gone into them. I'm happy to do so as to the grounds that we could cite for why that needs to come to an end, but it includes lots of pressure from city and county employees who are affected by it, and it's affecting the delivery of essential public services and ultimately threatening level of service for the entire community of Bellingham. So in a nutshell, that's where we're at. I'm not announcing a date at which there'll be a physical dispersal. Again, I'm going to spend the coming weeks earnestly, diligently working with people, organizations to try and increase capacity. And I hope to have a humane process by which the exit begins. I hope to ask various care providers from different organizations in the community to assist in some engagement on the ground. There's lots of people at the City Hall encampment who have been in various organizations and have caseworkers that they've been engaged with over time, and going to reach out and find some times when they can come in and we can create a process by which there can be some engagement and assistance and help. And hopefully create a peaceable transition. That is what we're doing. From the administration perspective, we have diligently, we care about this situation, but it's time to get past this particular phase of it at City Hall. And that's the briefest summary I can offer, Barry, in a nutshell.
Okay, thank you, Mayor Fleetwood. Questions, Marcus?
Yeah, I took a few notes, so excuse me if I line by line just a little bit here, guys. Thank you, Mayor Fleetwood, for that. I'm appreciative, by the way, that it sounds like there's going to be a joint session coming up between county and city, and I'm hoping that all civic officials will be present for that to show that they care about this issue. I'm hoping for a robust back and forth between stakeholders like volunteers on the ground, myself as the advocate here, as somebody who's been in negotiations with the mayor on and the collective, as they're called, the people who are trying to represent the grossness, the gross largesse of the group on the ground. They are the collective. So a group of people has been identified, pushed forward to represent all of them, but they are representing themselves. I beg your pardon. I beg your pardon. Do you have me now?
Yep, we got you.
Yeah, I'm sorry, and so yeah, I've been privy to the negotiations, and I have found that I'm trying to help the collective also see things as we have give them some history, some precedents, and to see if they can achieve their goals. And I'm trying to negotiate this with my sole objective as being trying to get these people safely sheltered into safe transitional shelter programs leading to permanent housing at the end. I'm not into anything that looks like a temporary solution. Motel vouchers are something that seems to be largely ruled out right now. There's a lot of whereases, and I can unpack them, but it has largely come to an agreement that, other than motel vouchers and the tiny homes that are just down the street, the tiny homes are the only viable, acceptable severe weather sheltering and the winter emergency sheltering. These are shelters that can be used in a COVID. And so I find that it's very important that we recognize that. I personally have a plan and my ideas of it. It seems to go along a lot with what the collective is trying to do. And in both of our ideas and what we've been presenting with the city, neither of those we're not getting close to that yet with negotiations. We need to serve the people, all of the people on the ground, not just a small handful. And that seems to be what's being proffered so far, and even only in so much as indicating the willingness to purchase the structures without actually doing so. This is an emergency, and I'm asking for all civic leaders to please appreciate that there is a precedent for both city and county in taking these shelters. I'm hearing from Mr. Fleetwood that the pressure has increased from staff to end the encampment. I'm hoping that that you can at least acknowledge that there's a lot more pressure from the citizens who are risking themselves, who are putting themselves at much exposure vectors, coming and going with blankets and sleeping bags and extra coats and boots, and somebody says they need firewood, and everybody's push, pull, dragging. The citizens are doing this effort. It's entirely a citizens effort. I appreciate that Mr. Fleetwood has asked for different different participation from different government contracted helping services that are not being there. I mean, we really need the hot team to come and engage. What a wonderful opportunity for you all to build relationships with our mutual clients. Same goes for the mission, although I think that largely you've kind of burned up your time on this. A lot of with it is disingenuous narrative on base camp to say that there is any capacity there to be had readily at all. You have to pass through the eye of a needle to get there. You have to book an appointment by telephone or email and then meet that time requirement to be there. Like I said earlier, there's communications. People barely have that ability, let alone the will sometimes, because they feel like they're being forced through too many hoops and they just fail to do so. And they, choices are one of the things that goes first when you're out there trying, when you're trying to feed yourself and trying to stay warm, and people don't make the best choices sometimes. I can't tell you enough how much recovery I've seen on the ground out there. I can't tell you how the miracles that have happened there. You just have to take my word for it. People are kicking drugs, people are kicking alcohol, people are connecting with services for the first time in years. It's a miracle just to get a little stabilization, and I'm asking you to acknowledge how that can work in a tiny home. I'm also hearing the narrative coming from the city from Mr. Fleetwood just now on that services are being threatened. Most of the services are shut down. The People's House has been closed for well over a month, and that means that people can't just go in there to just use the bathroom and come out. And yes, I understand that there have been some difficulties, and believe it or not, at least 18% of the people, as has been stated on the record years ago, are severely mentally disabled in this crowd. So we have to acknowledge that they're there. We have to have compassion for them, and we have to provide for them, of course. So if you're feeling like your services are threatened, first let's examine how you've discontinued most of your services already, and you've closed the door to the rest of the citizens. I would also like to engage just the narrative of exiting. Exiting this encampment. As I said, 25 homes more is not going to clear your lawn. It's not going to happen. It is considered a protest. These people did come on. I also want to correct November 11th was not the start date. It was November 10th. They went in there right after a county council meeting. I went on November 11th in the morning myself because I heard on Facebook that there was an encampment. I went there because outreach is what I do. And when I got there, I served 4 people out of the 5 tents there, and they all looked occupied to me. So I don't know where that narrative came from either. Partners on the ground. Yes, I just kind of addressed that. I want to see the hot team. I'd like to see maybe the mission save face and get some partners on the ground. I begged them for the shower trailer in the first weeks. I begged them to have Street Connect come. Begged Hans personally to have Street Connect come by. I've begged Hans to give me the list of people who he thinks are base campers in our camp, because he seemed to have a list, and I asked him to provide that to me so that I could help him get those people over there, and that was ignored. We're asking for a peaceable. And before I go there, I just want to say that we've got. It's been largely accepted back in March that we have somewhere close to 1,000 homeless people in Whatcom County. That number has definitely increased. I guarantee it. 13 to 15 is what we're probably looking at right now, guys. This is for real. I'm watching so many people when you lose your housing, you can't go get it again. If you break up with your roommate or your girlfriend and you end up on the street living in your truck, there you go. You get that truck towed, welcome to base camp. Not this time. Base camp's been directing people to Camp 210, who they will not allow in, and they're not even giving them a blanket to do so. Also, your police officers.
Marcus, we need to let other people be able to speak.
Okay, I'm almost done.
Monopolizing a little bit. Can you
One more point. One more point. You bet.
Sure.
One more point. I was line by line. And the police officers have also been sending people who they did break up their camps, sent them to 210. That is testimony from campers there. It's written testimony, and it can be provided too. Peaceable transition, that's been a wish that I've heard from you, Seth, but I keep hearing this exiting talk, and I don't see you guys coming forward with enough. So I'm hopeful that in the joint session, we can all make recommendations to our executives to handle this so that ideally we have a larger congregate setting at St. Joe's, the old St. Luke's campus area. That's a whole city block of parking lots. If we can get them to help us out with that, we can fit several camps on there and then disperse them through the city into neighborhoods on regular permits with different partners. But first, you must provide this housing in an emergency and severe weather frame. Thank you.
Hans?
Yes, thanks. This is Hans Richinger Davis, Executive Director, Lighthouse Mission Ministries. First off, I should say my staff really miss the folks that left for Camp 210, and we welcome you back with wide open arms. We currently, as of yesterday, have capacity, including our overflow shelter, for 130 people. And our doors have been wide open to receive up to 130 people the last 2 weeks. And a lot of that came with the support of Unity Cares giving us those tests. The 15-minute COVID tests allows us to let people in at any time. It's not the case that you have to make a phone call or email. That was for about a week prior to 2 weeks ago to get back in, but you can walk up and we'll get you tested and get you in our doors as soon as possible. So that's, you might have to wait a little bit if it's really busy at the moment, but you are more than welcome to come back. And we do welcome all, even folks, if you've been trespassed due to violence or drug dealing or things along those lines, we are happy to have you back. It might require a safety plan, but just talk with the manager. We want you back. This is our aim. We want to get you plugged in and get you all the services you need to get you the life that you want. Big thank you also to the health department for the weekly testing that's been going on. I see you there, Ann, both ends. Thank you very much for that. That's been a huge help. I know we've been able to pick off a few folks that have COVID-19, and then big thanks to the IQF to be able to host them or anyone that has been in contact with somebody that comes up hot for COVID. The COVID, we're getting our staff, actually, all our staff are getting vaccinated here this next week. And so we're really excited about that, furthering our COVID, fight against COVID. We're just recently got all the ventilation at base camp as well, has installed special ionizing filters that kills COVID. And it's been we're further excited about how well we've been able to tamp down these little brush fires that pop up on occasion. And then too, I'm thankful for the staff that are able to maintain a really supportive structure at base camp that allows people to stay safe, and we're able to really monitor well the coming and goings of folks that might be in contact with anything related to COVID. So the reality is the doors are wide open and have been for 2 weeks for people to get back into base camp. We have capacity for 130 people, and we're excited to get those folks back. It's not unlike there was a camp out at City Hall 2 or 3 years ago, I remember, and I think it was shut down after a few weeks, and our numbers dropped significantly during that camp out as well, and then we just fill right back up again once those camps get shut down. Anyways, we more than welcome anyone that's listening that might be staying at Camp 210. Please come back. Our staff miss you, and we're happy to be here to support for you. That's all.
Okay, Marcus, you have something quick because we need to get to public comment.
Is that me?
Yeah, go ahead, Marcus.
Yeah, hi. No, I couldn't hear you there. Thank you for that, Hans. I've heard the all welcome narrative repeatedly from you, and yet we keep coming to these points where the services are denied. And so I'm trying to get past that. I think that Mr. Lilliquist was very accurate with his summation that you talk about the availability, and you talk about the availability of capacity at the 39 beds at that CTK can host over at the drop-in center. That's not going to happen at your current rate. You've been talking about wide open. So that's the first I've heard of that. I'm inviting you, Hans, to please stay with me on communications instead of closing me out, because that's something, because believe it or not, I have mutual clients with you on the lawn at 210, many of which are really upset that they're not allowed there. So that would have been a great narrative to hear. You say 2 weeks ago? That'd be great to hear now.
It's been on social media the whole time.
Guess where they're not? Guess where they're not? Guess what? I'm blocked on your pages too, so I don't see it too. So anyway, guys, everybody welcome. It's a constant narrative. I just want to say this, if we've got 1,500, 1,300 maybe people who are homeless in Whatcom County, to count on the 200 beds that are available at base camp and put everything on that. To quote Rick Sepler, we're putting, this was back when BHS was our shelter, and he said this to my face. We're putting all of our eggs, the city of Bellingham is putting all of our eggs in the BHS shelter and the Byron IQF facility, both of which are run by guess who. So here we are. I mean, we have to do better. I'd like to make a point quickly about vaccinations. Camp 210 would love some of those. We've got heroes working on the lawn down there. We've got vectors we're trying to capture. We would love to have the vaccinations down there available to us. It is disingenuous if anybody at base camp gets those when the largesse of the population is actually on the lawn at 210. And especially if anybody considers that to be higher risk, which I don't believe it is. And I think it's rather been proven by the numbers. Also, ionizing filters proven to kill the virus. I'd be glad to see that data too. Indoors is not a good environment. CDC recommendations, blah, blah, blah. Hey, I'm ready to go off to public comments. If you all are, thank you so much for your time.
Emily.
Barry, this is just a quick and unrelated question, but I'm wondering, this is usually the time of year when we're planning for a point in time count. And that just seems maybe relevant to this group, and Ann, I'm wondering where that is from the health department standpoint.
Staff is, Barbara and Chris have been working on this. They had a meeting, I think today. I think they're trying to figure out how to address it this year, especially the unsheltered piece of it and how to best and safely do that. So it's in the works, and I know it's coming up soon, and they're talking with all their counterparts in fellow counties and to see how it's going to go. So it's on the radar. I just don't have anything concrete to tell you.
I wonder if that's something that could maybe go on the agenda for next time, just so that we don't lose track of either an update or Ann, if there's anything this group can do to help brainstorm or think through. I heard some like federal bits about you don't have to do it this year or something. And I'm like, that seems like a horrible idea in the context of like to skip a data point this year seems like equivalent to like, let's just not do testing or something. So
we'll put it on for the agenda and we'll check. We'll have more information for you then.
Great. Thank you so much.
Mm-hmm.
All right, folks, we ready to go to public comment? Okay, I will open the public comment period, and Kathy Halka, could you please call our first speaker?
Yes, if you'd like to speak during the public comment period, please raise your hand virtually by clicking on the hand icon on your screen, or if you're joining by phone, you can raise your hand virtually by dialing *9. Each speaker will have 3 minutes to speak. And our first speaker is Doug Gustafson, followed by Hannah Stone. Just a second, please. Go ahead, Doug. You have 3 minutes.
You guys can hear me, right?
Yes, go ahead, please.
Cool. This is Doug, chairman of HomesNOW. I just wanted to say thank you to the city and the county for working with us to set up Swift Haven. Things are running very smoothly there. Unity Village is also running very smoothly right now. We got all the 25 tiny homes today, or it might be 24. Like we thought it would be 25, but it looks like it's 24 based on what we counted. All I have to say is that this is an example of when the city and the county and a nonprofit work together. In a short period of time, results can happen. I think that Camp 210 has provided the opportunity for some of these things to happen. The COVID situation has created an emergency situation in which action can be taken faster than under a standard process. We appreciate that. I also wanted to say that HomesNOW does have the capacity to take on a third site if the city decides that that's a good idea. We can't handle a fourth site right now, but we can handle 3 sites. And we basically are trying to house people. I mean, when the eviction moratorium finally does expire, there's going to be a lot more people out there. There are a lot more people in the woods too. They've always been there. Even if Camp 210 gets cleared, forcefully or whatever, that they're just going to go somewhere else. They're going to go to the streets, or they're going to go back into the woods, and the problem's not going to be solved. I appreciate that the mayor has chosen the position of trying to find housing while they're at Camp 210. Just like with Unity Village, just like with Swift Haven, the fact that there is a camp there, I know it affects people, but it creates a place where you know where they're at, even if things do happen there, because it's kind of an unregulated situation. But that's provided the vehicle in which, like, if we're trying to get people into housing or something like that, people that are doing interviews, they know where to go, and they can actually, talk with 5 or 10 people at once. And 80% of the people that have been let into Swift Haven were from Camp 210. We're camping at Camp 210. And HomesNOW is a big believer in the housing first model. So once people get into housing, they still have all the problems that they might have, but it gets mitigated. The other part is the community aspect, because when you're talking about issues like addiction or mental health, like sometimes the issue is a lack of connection with other people. So when you have a community where people are having to help each other out, and you have a supportive board and staff to support them where they need to, even if you don't know exactly what services they need or whatever, just that goes a really long way. You treat people like friends and family, they get to know you, and then any issues that did previously exist, they still exist, but it gets greatly mitigated. And I would encourage...
Time.
Okay.
The next speaker is Councilmember Hannah Stone. Go ahead, please. You have 3 minutes.
Thank you. Good afternoon, everybody. It's good to see you. I just wanted to take a moment to clear up any misunderstandings. So there was notice recently issued that there will be a special meeting held on Monday with the city and county council members. But I want to be clear that so Chair of the Whatcom County Council, Barry Buchanan, and myself have been working on this meeting, but this meeting is really looked at as an internal work session with the executives and the councils to discuss issues related to homelessness. And there will not be public comment or dialogue with stakeholders at that time, but we will have discussions and hopefully actions moving forward. So I just wanted to make sure, since this is publicly broadcast as well, to let the public know that that meeting on Monday will be obviously publicly broadcast, and we hope that people will be watching, but just to set those expectations ahead of time. So thank you for the opportunity to speak.
The next speaker is Ida Cardona. Go ahead, Ida, you have 3 minutes to speak.
Hi, can y'all hear me okay?
Yes, consider please though turning down the speaker in the background because there's a bit of an echo.
Sorry, yeah, I'm also watching at a broadcast, so I'm walking away from the TV here at camp. Hi everyone, my name is Ida Cardona. I'm a student in the business management, entrepreneurship and innovation and arts enterprise and cultural innovation programs at Western Washington University. I'm also a board member of Cascadia Community Land Trust, a volunteer and organizer here at 210 Camp, homeless and civil rights advocate and activist. I am reaching out now in an act of, honestly, desperation to find creative solutions to be able to house our unhoused population. Right now, what's happening at HomesNOW with Swift Haven is amazing, right? What we're doing here on the ground is amazing. The problem, again, is the city and the county and the current municipal codes as they stand that are preventing us from being able to have access to all the resources that we need in order to run an effective shelter. What we're seeing right now is that we are dividing our houseless population between different camps based off of what their individual, qualifications are and satisfying requirements to gain access to specific shelters. And ultimately, there's always going to be that issue if we do not have a no barrier shelter option, or if codes aren't being looked at in order to change to offer access to all people. We need permanent housing solutions for all people. I understand that we're under, we're under an emergency conditions, and that right now we're working towards solving, the potential deaths that will happen from the emergency conditions. However, we're not going to be able to solve the problem long term if we don't look at, again, the creative solutions that there are tons of them. It's just a willing to be able to take risks and see what we might be able to accomplish if we change the barriers, the actual barriers, the codes, the policies themselves from the inside out. So I'm really curious and looking forward to what happens at this internal meeting on Monday to see how we might be able to address those specific issues, what resources we can actually bring to our community, regardless of like what their backgrounds are,
30
what
seconds, please.
conditions that they have in place. Thank you. And how we can move together progressively, not only to put a Band-Aid on this issue, but to also offer long-term solutions by nature of changing the system as it stands. So I yield my time for now. I appreciate it.
The next speaker is listed as Camp 210. Go ahead and please state your name for the record. You have 3 minutes.
Hey, this is William Shankin. I'm down at 10. I've been a volunteer here since it's been going. I've been living in Bellingham since 2002. The problem is right here. It's the government. The community is coming together, trying to service these people, trying to give them a chance to survive this winter, trying to give them a chance at some stability. And the barriers are the government. The government doesn't want a shanty town. Well, then you need to figure out a way to get people housed. You don't want to give shelters to us without an entity, then you be the entity and service people out of the shelters. You know, the zoning laws are what created this problem. And you stand there and behave like it's something that just came out of nowhere, and it's the policies that you've developed that favor the rich people who want to have pretty houses over the lives of actual human beings. And I want you to know, Seth, that we're all very aware that you said you weren't going to sweep the lawn until you came up with solutions, and you haven't come up with solutions. What you've done is waste all of our time with negotiations about something that was never going to be practical, given that was never going to meet everyone's needs. In 5 different ways, the offers that you've made still leave people out in the cold. And these brave people down here are not willing to leave people alone out in the cold. Rick Sepler can say all he wants that some people aren't going to go into programs that they're not, they can't be helped. We are not going to accept that. We are going to do everything we can to make sure every single person here is taken care of, whether they're addicted to drugs, whether they're mentally ill, or whether they've freshly lost their homes. Some people here were working simply months ago, and then COVID forced them out of their jobs and then out of their homes and onto the street. It is a disaster without a crime scene. If this were an earthquake or some other thing, then it would all be visible, but it's slow rolling, and this is the result on the lawn. You got to get out of our way and let us, the community, solve the problem if you won't. Thank you.
The next speaker is Melissa Weisner. And if anyone else would like to speak, please raise your hand virtually by clicking the hand icon on your screen or dialing *9 by phone. Go ahead, Melissa, you have 3 minutes, please.
Thank you. It's Melissa. I'm just gonna go off of what everybody's been saying. These people out here are deteriorating, and I need a place to put them. I have one that I just got in to get medical care, and they're already talking about cutting them loose, and that person is not even remotely stabilized. These systems that are already in place are failing these people, and I need to have a shelter to put them in so that I can make sure that they can continue to get the care that they need, because without being monitored, they can't get this care. They're relying on people who cannot care for themselves to take care of themselves and their medications, and it's not acceptable. 99% of what I do every day now when I'm not working my real job is caring for these people, and at least 80% of what I'm doing to care for them would be lessened and a million times easier and a million times less catastrophic if we just had shelters to put them in. Whatever operator you got to get, whatever's got to be done, we need to get this taken care of. These people are going to start dying on your watch, and it's going to look really bad. Everyone's looking at this point. I mean, we're being bullied by your police officers. They pulled over one of my donors last night and shook her down and harassed her, or night before last. This is getting out of hand. We need shelters. We need them now. These people are in danger every minute that they stay out there. Thank you. I yield the rest of my time.
If anyone else would like to speak during the public comment portion, please raise your hand virtually by clicking on the hand icon or dialing *9 by phone. The next speaker is Sherry Lapoff, followed by Arisa and Turner. Go ahead, Sherry. You have 3 minutes, please.
Good afternoon. Always appreciate this discussion. It became clear really early on to everybody that, and especially when negotiations were starting to happen pretty positively for both sides, and it became clear that very possibly most or half of people there would be housed in some way, and it would leave a big chunk of people to go back to the woods, if that's what we're talking about now, that are not able to care for themselves. They are not able. That's why they don't have a home. They're not able to keep a phone. They're not able to take care of themselves, either for physical disabilities, but mostly for mental disabilities. And I absolutely encourage us to get these people housed, but it has to be with paid professional support. It really can't just happen just by the housing alone. It has to be paid professional support. And let me say again, this is going to cost us, me, taxpayers, you, a lot of money in the next many years for this tsunami that is about to crash on us. And we have to look at it like that. We have to look at it financially, because it's going to cost a lot of money. Volunteers cannot bear the burden of this, and as they are right now. On another note, they're about half settled in at Swift Haven. I'm helping over there, and the residents are thrilled. They're not perfect. They are tiny, and they don't have beds. They have some wide benches, and they don't have mattresses yet. I understand those things are coming, and it is tiny, but they are so grateful and so thrilled. One of the residents of just a couple days is going to go into a longtime drug user is going to go into rehab, and that's kind of the part of his program there. Go into detox and rehab, and the house will be there for him when he's done. Another young man moved right in, was given a donated laptop, and he has a financial plan for a business plan for a little business he wants to start. He's looking for a truck, has a couple $100 he's saving, and it's just very, I guess, so subtly joyful over there, just happening, just exactly what's to happen. And we, the city, county, and anybody that's been involved in this absolutely deserves congratulations for this wonderful thing that's happening over on Jerry Field. Thank you.
Next speaker is Arisa Owen Turner. Please state your full name for the record. You have 3 minutes. Go ahead, please.
Hi, my name is Arisa Owen Turner. I'm a resident of Bellingham. I'm the mother of a disabled child. I've been spending a lot of time reading reports. I have done nothing pretty much in the last 3 weeks other than read reports from the city, from the county, and from the state. What stood out to me the most is that in the county's comprehensive plan, in the original draft, there was a dire warning. And I would say, screaming from the rooftops, from the consultant paid to help give an impartial analysis of how the housing was going to go in this area and whether or not it would match up with wages and what that could look like. During the draft process, it's shocking. It's absolutely shocking to read because almost everything was taken out that came from that consultant. And right now, what's happening out on Camp 10 is basically what that consultant was warning of. So to me, the just outright disregard of all of the numbers, which pointed out low availability of housing as far as sales and rentals, and decreasing wages with an absolute positive prediction of population growth in this area. When you add those 3 things up, this is what you get. This is not a surprise. Nobody's surprised that there's not enough housing right now. Sure, we didn't expect a pandemic, but we have to prepare for anything and everything. And since there wasn't enough preparation to even meet the demand that was forecasted, this just seems like an absolute disaster looking at it from the outside. It's frustrating. It's, as the mother of a disabled person, I can't tell you enough how heartbreaking it is to see people turn away from those campers. I see those campers and I see grown-up versions of my son. And I am angry at this point and considering moving out of this area because I don't trust any policymakers here to look out for his welfare. It is so shameful that I'm having to talk at public meetings at this point. And believe me, there's nothing, I do not want to do this. I would love more than anything to just look away and be oblivious to what all of you do on the job. But now we have a crisis in front of our faces and I can't hardly sleep at night because apparently the values of our community only seem to prioritize families with children and veterans. And I agree that absolutely they need some priority. But when you look at the numbers at our own point in time, they make up a pretty small fraction of the overall number. So that leaves us with pretty much ignoring 85% of the unaccompanied adults who experience chronic homelessness. And I'm tired of them being blamed for their own behavioral problems that aren't being addressed and the way that their brains are wired. I really urge all of you to look up executive function and get an understanding of what that is and how it can lead someone's life from the time they're in elementary school onto a school to prison pipeline and from prison or institutionalization to homelessness. I urge you to study those things. I urge you to look at your own comprehensive plan in this county and what was forecasted. I urge you to look at the strategic plan to end homelessness for this area. All of this information's in every one of these reports. All of you knew, if you have read any of these reports, you all know how dire this is and what was predicted.
Time.
Thank you.
If anyone else would like to speak, please raise your hand virtually by clicking the hand icon on your screen or dialing *9 by phone. I'll wait just one more second in case anyone else would like to speak. Yes, go ahead, HK Mobile. Please state your name for the record and you have 3 minutes. Go ahead, HK Mobile.
One moment, I'm on a mobile. How's my sound?
We can hear you. Go ahead, please.
Let me get rid of the feedback. Okay, I'm ready. You can start timing. Heather K., American citizen since birth. Greetings, councilpersons and city agency staff, and happy first week of the new year, 2021. Each week, I've continued to outreach and speak with our neighbors who are without safe shelter this winter, other than the cover they receive from a piece of cardboard, plastic, or nylon. Winters are especially intense due to strong winds, breaking tree limbs and tent poles, and due to reoccurring freezing rain, snow, and ice. Many of the unsheltered neighbors I listen to, who treat me like an equal, many express that although they do need and desire safe housing, they understand it's hard to find and they don't want to take shelter from anyone who has a greater need. Some of those I speak with have been unsheltered for many years. I give thanks to the patience of our Bellingham mayor. Our community respects his wisdom as individual citizens, both housed and unhoused, work together to supply a daily warm meal outside in the elements, while we continue to put forward the long-standing ask for creating additional shelter options that include safe private sleeping quarters for both families with children and individuals or couples without children. Thank you to the Port Commission leaders for offering port-managed land for an operator to manage a low-barrier camp village. A gap in care and accessibility of connecting our unhoused citizens to new shelter options, such as tiny homes through nonprofits and through the housed wait list managed by Opportunity Council. The gap is many, many unhoused citizens do not have cell phones or computers or power when housing does become available to them, nor can they apply online for housing. Even our public library is closed. Many of our unhoused citizens also experience medical and mobility challenges that limit them to going in person to a walk-in window to apply for services or to go to medical appointments, to receive care for wounds, or to receive prescriptions or to pick them up. There is also a gap in our tax-funded outreach workers in meeting their clients in person at their residences, especially those who reside sleeping outside on the ground. I'm hearing our indoor Zoom-connected city staff desires to end the encampment on our public lawn in the middle of winter, while I'm witnessing compassionate city and county citizens, both housed and unhoused, continue to outreach in person day and night, week after week, to work together, to share our attention, to share our meals, our blankets, our cardboard, and our water to those who are thirsty, tired, hungry, cold, and sleep deprived. We will continue our efforts. Thank you. I have more to share if you'd let me.
The next speaker is, we have listed as Ida Cardona, who's already spoken. I'll go ahead and allow you to speak in case there's someone else on your line who would like to participate. Go ahead, please.
Sorry, I gotta move away from the broadcast again, but yes, I do have someone else that would like to speak. This is Jenna.
Hi.
Please state your full name for the record.
Full name.
Jonah Laharn.
Thank you.
I'm pretty happy of like what we've seen here. I've been trying to stay hopeful and help build rapport with everybody here. I'm like really working to help everybody here stay on a good queue, and like I've watched as it rise and came down and rise and came down with the weather and how cold it is out here, and I've been with them, everybody here, like day in and day out, trying to see what we can do to get our place, get everyone here a place to live if that is possible. And I I'm really here with the spirit of the people, like just really happy that people are still pushing through, and like I really just am just trying to keep my head up, watching as the community pushes through to get us all together and get us someplace to go for everybody. And I'm really proud of just the level of evenness that people have had, or the balance that we've had to go through to see the different shapes of characters and that have came and gone, and I'm really trying to get people just really ready to get a place to go. And I see Michael Lillyquist. Hi, Michael. I hope I hope everybody's feeling good, and like I hope people are participatory towards this one singular cause, because even with the coronavirus, this is pretty urgent that people get a place to live, like especially with that, because if you expect people to wear masks and follow through with the mandatory orders and of governance and all that things, like we probably all should have a place to go that's safe and steadily like protective of our well-being, and everybody deserves a place to live, and that's always been my philosophy. So end homelessness, and that's all I have to say. Yeah.
The next speaker is listed as Camp 210. Please go ahead and state your full name for the record. You have 3 minutes. Go ahead, please, Camp 210. Please state your full name for the record. Okay, if anybody else would like to speak, I don't have any other hands raised. This is your last chance. Raise your hand virtually by clicking the hand icon. Councilmember Buchanan, there are no other hands raised at this time.
Okay, we will close the public comment session, and it's 3:08. I'd like to try to get you guys out of here by 3, but is there any last closing remarks? Joel?
Barry, if I can just kind of just briefly respond to the public comment, and sort of as it regards to wrapping up conversation about communication. First of all, I wanted to just say to those people, and Sherry and Heather and Jonah, the people that are on the ground and really helping out and sacrificing a lot to help our unhoused neighbors. You are the heroes of our community. And I'm saying this from the heart, that you are really inspiring to us and to this community. And I hope that you will continue, and I know this is difficult, and I know it's, it feels like, I know what it feels like. And trust me that there is light at the end of the tunnel, and we're going to get there, and it may not be as quick as you want it to, or I want it to, but we will get there. And I would just encourage you to keep communicating with your neighbors and with the community, because that's really what it comes down to. Is, we can only do so much here, but you are also you're a part of this community, and you represent a small part of that. But the more that the community knows about what's going on and what's being done and what these people are going through, the more people will step up and say, hey, we need to do something. So, and I think that's really what it's going to take, is to get the entire community. And that's why our focus in the communications is to really get that message out.
Marcus? Marcus?
Yeah, sorry, I just dropped out in the last sentence of that. Thank you for that sentiment, Joel. That was that's really appropriate and wonderful of you. Thank you. I also just want to add that I appreciate Councilwoman Hannah Stone's remarks on the joint session. I couldn't be happier for the joint session. It's something that I've personally been badgering so many of you about. So I appreciate you hearing me on that. I'm asking you once more to hear me on, we need more participation in that. I think there are some stakeholders on it. I know I certainly might like to have a back and forth with you in there, as well as people like who have been chosen to be able to represent Camp 210's interests, as Ida Cordona has been one of those who has championed throughout the process. And so I'd like to be involved. I hope that she is, and I hope that we can express the opinions and interests of the entirety of that group through ourselves. If no one else is allowed access, I would at least like some representation there. Thanks.
Okay, everybody. Again, Happy New Year, and we will see you in 2 weeks. Our meeting will be 2 weeks from today on the 22nd, and we stand adjourned.
The recording has stopped.